Hello, welcome to Nursing with Professor B. My name is Brigitte. I have a master's degree in nursing education. I'm also a family nurse practitioner. In today's video, I will be going over therapeutic communication techniques for mental health nursing. Okay, but before we get started, make sure you hit the like button, make sure that you subscribe, and make sure you turn on that notification bell. Let's go. Okay, so this presentation is made primarily for mental health nursing. These are considered therapeutic communication techniques, so they would help in everyday life. But the reason why I specify that this is for mental health nursing is because if you're just a Joe Schmo off the street, these techniques may feel a little funny to you, or you may feel that they don't work. So this is specifically tailored to help students pass mental health nursing, which is sometimes trips up a lot of students because therapeutic communication techniques are fluffy-lovey versus concrete. A lot of it can be more subjective versus objective. So without further ado, let's get started. The therapeutic technique of silence. I cannot emphasize enough how important this therapeutic technique is. Sometimes when I've worked in psych and I don't rush my patients and I just sit with them, they just open up. They verbally vomit, as I like to say. So someone that might have been hesitant to open up to speak because you're just blah, 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 right? As soon as you just sit with them and they notice that you accept them, they just open up. And it's amazing. So, as cliche as it is, we have 2 ears and 1 mouth. We need to listen more, speak less. So what does the therapeutic technique of silence do? It gives the person time to collect thoughts or think through a point. And as an introvert, that's probably my pet peeve is when, as an introvert, I like to think, I like to formulate my thoughts. And then my pet peeve is when people just cut me off, like I'm really thinking of what I'm going to say, and then someone just cuts me off and rushes to the point. And that tends to be a big difference between extroverts versus introverts. And in mental health, like someone is suffering through depression, or maybe they're having cognitive retardation, so their mental process is a little slowed down. We want to give them time to formulate their thoughts. So an example of this is encouraging a person to talk by waiting for answers. So don't ask your mental health patient a question, or your patient, and then immediately 2 seconds later jump in. For example, how are you feeling today? Oh, I know you must be feeling bad. I mean, yesterday you broke your foot. So, just give them time to answer. Therapeutic technique of accepting, also very important. As being a nursing, we have to be non-judgmental and accepting. So what it does, it indicates they have been understood. An accepting statement does not necessarily indicate agreement, but is non-judgmental. And it shows reception and regard. So for example, an example of accepting is eye contact and nodding. A non-therapeutic example would be like crossing your arms and shaking your head as they're speaking. Like if they're saying something you don't agree with and immediately you shut down and you're like, wow, that is not therapeutic. So the key word here is you don't have to agree with what they're saying, but you have to at least listen to them and accept what they're saying and not judge them for that. And I think that as a society, we've kind of lost that art right now. We're so politically divided right now that one side is not listening to the other side. So just whatever your mental health patients are going through, just sitting there, listening to them, making that eye contact, nodding so that they see that you're interested in what they're saying and they keep going and they don't feel like they're judged by you. Then we have the therapeutic technique of giving recognition. This one is very, very important. In mental health nursing, we do not give compliments. If on an exam, the answer choice is, which is an example of a therapeutic technique, and it's something along the lines of, I like your shirt, your hair is pretty. That's so if it's a compliment, it's not the right answer because that's the non-therapeutic technique of an approval statement. And in mental health nursing, we are not supposed to make approval statements to our patients because that is therefore passing judgment. Just how you could give an approval statement, you could give a disapproval statement. And also, we are there to build up their self-efficacy, their self-esteem, and not to rely on external compliments. So, the way around it is by giving recognition. So what it does, it indicates awareness of change and personal efforts. It does not imply good or bad, right or wrong. So for example, someone that hasn't been eating, you say and it shows that you noticed what they did. So I see you ate breakfast instead of saying, good job, you ate breakfast. And I see you've combed your hair today. So again, in real life, this may seem a little strange, a little weird, but in mental health nursing, this is a very important point, especially this giving recognition technique is frequently tested on. So the therapeutic technique of offering self, what it does, it offers presence, interest, and a desire to understand. It is not offered to get the person to talk or behave in a specific way. So when you offer yourself in as a therapeutic technique, you're not doing it as a manipulation tactic. You're not doing it to elicit a certain outcome. You're just being with them, and whatever happens, happens. So, for example, you would say, I'll stay with you a while. So a lot of times when people are down, just your presence alone is enough. Nothing needs to be said, just being with them. So, the example of offering self is, I'll stay with you a while. When you're taking your mental health exams, you need to know the therapeutic technique and you need to know how that technique is implemented. Therapeutic technique offering general leads. What it does, it offers the client encouragement to continue. It indicates that the nurse is interested in what comes next. The way that I give my students this example of offering a general lead, it's like you're leading them on to keep talking, right? It's like pulling an invisible rope, like, come to me, keep talking, right? So offering a general lead, an example of that is someone is talking and you're like, okay, and then go on. It shows that you're listening versus, I don't know if you've ever, and there are gender differences in how we communicate. Men tend to be more silent when communicating versus women. As women, we offer more general leads. It's just a gender, it's just a communication. It's just the way we communicate. I was reading a book on gender differences in communication. I can't remember the name of the book, but that was an example that was given. So a lot of times women think that men are not listening because men just stay silent, even though they may be listening. And then women will make the comment of, you're not listening to me. And then the men can repeat back everything that was being said. Or how many times, will you be talking to someone, let's say that they're texting or something like that, that does not show that they care. So if someone is texting as I'm talking to them, I'm just going to stop talking because you don't really care what I have to say. So offering a general lead is showing that you're invested in the conversation and you're giving them that positive affirmation, like, I'm listening. Yeah. Oh, wow. Really? Okay. And what happened next? That is what offering a general lead is. The therapeutic technique of giving broad openings. What it does, it allows the client to take initiative in introducing the topic. So broad opening, I think of Broadway, and like you set the stage for them and they just talk about whatever they want to talk about. So it emphasizes the importance of client's role in the interaction, and that should have an apostrophe there. Example, so this is you telling them, where would you like to begin, right? You set the stage for them, Broadway. Where would you like to begin? What are you thinking about? What would you like to discuss? So you set the stage and then you let them talk instead of you bringing up the topic like, hey, let's talk about your family today. Next, we have the therapeutic technique of making observations. What it does, it calls attention to behavior, examples, trembling, nail biting, restless mannerisms, and it encourages the patient to notice the behavior. They may not even realize that they are doing it. To notice the behavior and describe thoughts and feelings for mutual understanding. It's helpful with mute and withdrawn people. A lot of times people will be nervous and they don't realize they're nervous and they'll start biting their fingernails. I went out on a date once with a guy that had chewed through like half of his fingernail. Like it was up to half. He only had half a fingernail left. And it could be a nervous tick or hair pulling. Those are nervous mannerisms. A lot of times they don't realize that they're doing it. It's It's a self-soothing behavior. But if we help draw them attention that they are nervous, what is making them nervous? Making them more self-aware. So example, you appear tense, or I notice you're biting your lips. Is anything on your mind? Or you appear nervous whenever John enters the room. If she starts fidgeting when a certain um, either a patient or a staff member, like what if John is a staff member that's being really mean to this patient, and you notice that her behavior, her body language changes when John enters the room? That would warrant further investigation on your behalf. The therapeutic technique of encouraging description of perception, what it does, it increases the nurse's understanding of the patient's perceptions. Talking about feelings and difficulties can lessen the need to act them out inappropriately. A lot of times, you know that saying when we tell toddlers, use your words, when people are very frustrated and they lack the emotional development to express and use their words, a lot of times they act out behaviorally. So example, what do these voices seem to be saying? What is happening now? Tell me when you feel anxious. The therapeutic technique of encouraging comparison, what it does, it brings out recurring themes and experiences or interpersonal relationships. It helps the client clarify similarities and differences. So has this ever happened before? Let's say that they have a panic attack, right? Has this ever happened before? Can you tell me about the last time this happened? Is this how you felt when? Was it something like? So if we can put these events or these situations and compare them to others, we can have the patient recognize patterns and maybe prevent a future panic attack, or notice the underlying theme of why they're getting panic attacks, what situations are triggering panic attacks. And it doesn't just work for panic attacks, but that's an example that I'm giving. The therapeutic technique of restating, what it does, it repeats the main idea expressed. It gives the patient an idea of what has been communicated. If the message has been misunderstood, the patient can clarify it. So usually when I see restating on a nursing exam, I say, Polly want a cracker, Polly want a cracker. So the patient will say something along the lines like, I'm having trouble sleeping. And the nurse will say, you're having trouble sleeping? That's a more specific, that's how I usually see it on an exam. Because restating and reflection, which we will cover reflection a little bit in the future, you'll see that they can have similarities. In this textbook where I got this from, restating is not that verbatim, but again, I'm trying to help you, give you tips for exams, and usually restating is Polly want a cracker, Polly want a cracker. So an example here is patient, I can't sleep, I stay awake all night. Nurse, you have difficulty sleeping? Patient, I don't know. He always has some excuse for not coming over or keeping our appointments. Nurse, you think he no longer wants to see you? So these are examples from a textbook. I don't like them a lot because I feel like they are drawing a little bit of an inference. Whereas when I've seen restating on an exam, it's usually like more similar along these lines. I can't sleep. I stay awake all night. And then it would be like, you're having trouble sleeping, right? That is more similar of restating. One example when I was working in psych of where I used a lot of restating is where a patient had his vocal cords removed. So it was really hard to understand him. He would he would try to speak, but because his vocal cords are no longer there, it just felt like a lot of noise like this. So he would say something, and 90% of the time, I would have to repeat it back to see if that's what he was saying. So if he was saying like, I'm hungry, right? I'm like, oh, you're hungry? And then he'd nod his head. That is an example of where you would use restating because you're not really sure what he's saying. So I want to make sure I'm not misinterpreting, and I say it back to him. So I'm like, okay, this is what you said, right? Reflection or reflecting is the therapeutic technique. So remember restating, I said it's more Polly want a cracker, Polly want a cracker. The way I remember reflection or reflecting is that reflection has an F and an L in it, and it often has to do with feelings. So what it does, it directs questions, feelings, and ideas back to the patient. It encourages the patient to accept his or her own ideas and feelings, acknowledges the patient's right to have opinions and make decisions, and encourages the patient to think of self as a capable person. So It makes you reflect back, like you reflect back to them so that they can come to the solution themselves. This is the classic psychologist answer that like everybody knows. Like it's so stereotypical. So the example would be the patient says, "What should I do about my husband's affair?" And then the nurse, the therapist, whoever says, "Well, what do you think you should do?" Right? How many times Most of the time when people ask a question, they already know what they want to do. They just want you to agree with them. So this is an example of like what you should be telling them. What should I do about my husband's affair? What do you think you should do? Patient, what if you tell this woman to leave her husband and she wants to work it out, you know? Or the patient says, my brother spends all of my money and then has the nerve to ask for more. And the nurse says, you feel angry when this happens. So you see, she gets to the underlying feeling. And that's the difference between restating and reflection. And reflection, we either reflect it back to the patient or we talk about the feelings. Okay, the therapeutic technique of focusing, what it does, it concentrates attention on a single point. It is especially useful when the patient jumps from topic to topic. If a person is experiencing a severe or panic level of anxiety, the nurse should not persist until the anxiety lessens. So, focusing works well if someone is manic or has schizophrenia and they have loose associations or flight of ideas, and it's like, okay, let's focus back on what we were discussing earlier, and then refocusing them because they were here, then they're over here. And focusing them just brings them back to what we were talking about before, because one minute they're here, the next minute they're there. So we got to bring them back, especially if we're asking them questions that we're trying to elicit, like, are you having thoughts of harming yourself? And then they start with harm myself. I wouldn't harm myself, but I thought when she did, like I can't even imitate. Example, this point you're making about leaving school seems worth looking at more closely. You've mentioned many things. Let's go back to your thinking of ending it all. All right, the therapeutic technique of exploring, what it does, it examines certain ideas, experiences, or relationships more fully. If the patient chooses not to elaborate by answering no, the nurse does not probe or pry. In such a case, the nurse respects the patient's wishes. We never manipulate our patients and we don't probe or pry like this said. So we are only there for whatever the patient wants to share with us. If they don't want to share with us, we don't force them to share with us. So tell me more about that. Would you describe it more fully? Could you talk to me about how it was that you learned? Could you talk about how it was that you learned your mom was dying of cancer? And then if they say, I don't want to talk about it right now, you could say, okay, I respect that, or that's completely fine. And then once they're ready to open up to you, you can come back to that. Giving the therapeutic technique of giving information, what it does, it makes facts the person needs available. It supplies knowledge from which decisions can be made or conclusions drawn. For example, the patient needs to know the role of the nurse, the purpose of the nurse-patient relationship, and the time, place, and duration of the meetings. Sometimes by giving information, you can alleviate anxiety in patients, not only in mental health, but patients that are going for surgery, right? They want to know, okay, what's the process? What's going to happen? By giving them information, you alleviate a lot of their anxiety. So my purpose for being here is examples of giving information is the medication is this or the medication is for, or the medication is for, the test will determine, seeking clarification. It helps patients clarify their own thoughts and maximize mutual understanding between nurse and patient. Examples are, I'm not sure I follow you, or what would you say is the main point of what you just said? Or give an example of a time you thought everyone hated you. So for example, if the patient's like, I just think everyone hates me, and you're like, can you give an example of a time you thought everyone hated you? You're wanting to clarify. You're not sure where they're going with something, so I'm not sure what you're saying. Can you clarify for me? Presenting reality, you would do this a lot of times in schizophrenia. It indicates what is real. The nurse is not arguing or trying to convince the patient, just describes personal perceptions or facts in a situation. So if a patient thinks that Dr. Todd is in the mafia, the nurse is going to respond with, that was Dr. Todd, not a man from the mafia. Very neutral, very matter of fact. If a patient is scared because they hear They're like, oh my gosh, gunfire, gunfire, gunfire. You say that was the sound of a car backfiring, right? You present reality. You misinterpreted the stimulus. This is what it actually is. Your mother is not here. If they think that you're their mom, your mother is not here. I am a nurse. Voicing doubt. Expressing uncertainty regarding the reality of the patient's perceptions or conclusions, especially in hallucinations and delusions. This is a big one. So whenever you have a question on delusions, you never challenge a delusion. It's very like you don't argue with a delusion. The only thing you can do with a delusion is voice doubt. They frequently test on it. What therapeutic technique would you do is voice doubt. And even though, in my opinion, telling a patient that's delusional, that's hard to believe, would incite a very defensive response. Remember, in textbook world, you need to pass your test before you can become a nurse. This is a therapeutic technique for delusions. You voice doubt. So you never argue a delusion. You don't challenge a delusion. I have a video on what is a delusion. You can watch that. But a delusion is a false fixed belief. No matter what you tell them, they believe it. It's deeply ingrained. So you can say things like, if they say, I am the King of England, you can say, isn't that unusual? Or that's hard to believe. Or really? And I tell you 99% of the times, if you are to use this in real life and you say really to them, they're like, yes, of course, my mom is the Queen of England and I'm the King of England. Seeking consensual validation. It clarifies that both the nurse and the patient share mutual understanding of communications. It helps the patient become clear about what he or she is thinking. Tell me whether my understanding agrees with yours, right? So let's see if we're on the same page. Verbalizing the implied. This is a therapeutic technique. A lot of times students will pick this as a non-therapeutic technique, and I think I will do a video on examples of non-therapeutic techniques, so test answers to not pick on an exam. But verbalizing the implied puts into concrete terms what the patient implies, making the patient's communication more explicit. So I can't talk to you or anyone else. It's a waste of time. And then the nurse says, do you feel that no one understands you? So the implication, and again, this one is very similar to reflection. So I really would hope that on an exam, your teacher does not put reflection and verbalizing the applied as the same answer choice, because that would be honestly very tricky. But remember, reflection, we're reflecting back. What do you think you should do? Or does this make you feel that way? Whereas verbalizing the implied, this person says, I can't talk to you. So do you feel that no one understands you? It's not just about the feeling. Do you think, they could have very much used the word like, do you think that no one understands you? Because we're getting down to the implication, not the feeling, and reflection has to do with feelings. Or this homework is a waste of time. And then you could say like, do you feel like this homework isn't going to apply to your future as a nurse? Or do you think that this will not apply to your future as a nurse? I hope that you see the difference. Encouraging evaluation aids the patient in considering other persons and events from the perspective of the patient's own set of values. How do you feel about? What did it mean to you when he said he couldn't stay? Sometimes when individuals are psychotic, they have schizophrenia, and they're having an acute exacerbation, they will say bizarre things, but then there will be an underlying truth to it. There was once a situation where a patient on the unit was complaining of little men stabbing her stomach, stabbing her intestine. She actually had appendicitis, so she was actually in pain, and it probably did feel like little men were stabbing her. So always listen to your patients and don't just discount them as, oh, he's just totally out of it, right? So if a patient says, patient, I am dead inside, you could say something along the lines of, are you saying that you feel lifeless? Does life seem meaningless to you? Like, what do they mean by I am dead inside? And let's translate this into feelings. This is not one that is frequently tested on. I will just go ahead and tell you, the ones that I started in the beginning are the more frequently tested on. Suggesting collaboration. Collaboration, anytime you see the word collaboration in nursing, they love collaboration. So that, if you see anything, what's therapeutic, obviously read the responses, but collaboration is always considered positive, therapeutic, etc. So collaboration would never be suggested as a non-therapeutic technique. So if there's ever an answer choice that's like, which technique is non-therapeutic, it's not going to be collaboration. Suggesting collaboration emphasizes working with the patient, not doing things for the patient. We want to increase their self-efficacy. What does that mean? Self-efficacy is like the belief that they can do things for themselves, that they can function in society. When you do things for people, you almost make them dependent on you. It encourages the view that change is possible through collaboration. And then examples is, perhaps you and I can discover what produces your anxiety. Perhaps by working together, we can come up with some ideas that might improve your communications with your spouse. So involving the patient in the plan, not just telling them, tell your spouse this. Then next time that the patient is in a pickle, they may feel like, well, I need that nurse. She's the only one that can tell me how to communicate with my spouse. You're not going to be there holding their hand. Summarizing, it brings together important points of discussion to enhance understanding. It also allows the opportunity to clarify communication so that both nurse and patient leave the interview with the same ideas in mind. Have I got this straight? You said that during the past hour, you and I have discussed. Summarizing, it brings together important points of discussion to enhance understanding. It also allows the opportunity to clarify communication so that both nurse and patient leave the interview with the same ideas in mind. So, have I got this straight? You said that during the past hour, you and I have discussed. It shows that you listen to them and then you're clarifying and you're on the same page and you know where you are up until that point. And this is good to show that you have been listening too, because when someone says something to you and you can summarize it at the end, it's very satisfactory, like to the patient, like, okay, so you told me this and this and this, correct? And they're like, yeah, okay, this person was listening. Encouraging formulation of a plan of action allows the patient to identify alternative actions for interpersonal situations that the patient finds disturbing. What could you do to let anger out harmlessly? The next time this comes up, what might you do to handle it? What are some other ways you can approach your boss? This is important because when things happen, if something upsets someone, and then instead of having them feel helpless, we give them a plan of action, like how can we make this outcome be different next time? Okay, thank you so much for watching. If you want a copy of this PowerPoint, then please subscribe to my channel and then send me a screenshot that you subscribe to my channel and then email me at nursingwithprofessorb@gmail.com. As a bonus too, I'd really like it if you followed me on Instagram. But send me a message that you subscribed, show me a screenshot that you subscribed, and I will email you a copy of this PowerPoint as a PDF, nursingwithprofessorb@gmail.com. Thank you so much for watching. If you have any questions or video requests, make sure you drop a comment below. All right, make sure you hit the like button, make sure that you subscribe, and make sure you turn on that notification bell.